Are you a busy woman who prioritizes everyone else's health above your own? Do you have questions about your diet, exercise, or how to prevent or treat certain health conditions? Are you always Googling health questions that you forget to ask or are embarrassed to ask your primary care physician? Girl, do you even have a primary care physician? Well, welcome to Headed to Healthier. I'm Dr. Brittany Anderson, a board-certified family medicine physician, and every day in my private practice, I have discussions with women just like you who are doing their best to juggle the demands of life while also desiring to become healthier. Inside this podcast, you'll find practical and actionable health tips that you can incorporate into your daily life. You'll get expert advice and insight from some of my awesome healthcare colleagues, and you'll hear relatable conversations with incredible women just like you who have made their health a priority and are thriving because of it. So throw on your sneakers and get some steps in while you listen. Or if you're driving, get those hands at 10 and 2 and let's dig in. We are headed to healthier. Welcome back to today's episode of Headed to Healthier. I'm so excited to be joined again by Dr. Shawn Johnson, an orthopedic surgeon out in Texas. Dr. Johnson is the first repeat guest on Headed to Healthier. So, Dr. J, so great to have you here. For those who missed your knee episode, ladies, you missed an absolute treat. So make sure that you go back. It was one of the first few episodes that I released on the Headed to Healthier podcast. So please go check it out. But if they somehow missed it, Dr. Johnson, tell us a little bit about you, how you trained and what you do every day.
So, hello, and thank you for having me back. I am Shawn Johnson. I'm born and raised Houston, Texas. My background is, I do have a military background. I did my residency in the Army and then went on to serve as an active duty orthopedist, 2 combat tours. And then once I resigned my commission, went to do a sports fellowship, worked in New Orleans for a little bit, and just outside of New Orleans for a little bit, and then moved back home to Houston, where I initially started as an employed orthopedic surgeon and came to realize that private practice was going to be a better way for me to go. So that's where I am now. And my practice is primarily mobile, which is a new concept. Still spreading and still trying to gain some traction, but I also do some contract work here and around the greater Houston area.
Awesome. And you and I were talking just before we started to record this episode about the mobile work that you are doing. Ladies, imagine your orthopedist coming to you. I think that is such a cool concept. And I look forward to us talking about it just a little bit more as we go on. But if you are in and around the Houston area, then definitely do check out Dr. Shawn Johnson. And we'll ask you, I guess, towards the end of our recording here to let us know where you are. I know you're active on social media, so places that listeners can find you and follow along for some great ortho tips and ortho advice. Like I mentioned, you came on once before and we talked all about knees and knee pain in women and how it relates to hormone changes and, you know, what physical exercise requirements we have and all the things. And today we're going to continue that discussion, but we're going to go a little bit different angle and talk about shoulders today. So excited to talk to you about shoulders. That knee episode, again, really resonated. It's been the highest listened episode so far, Dr. Johnson. So thank you for that. But today, let's shift up to the shoulder. Can we start by just asking you why you feel like you see shoulder pain so commonly in women, especially as we get in our late 30s, 40s, early 50s, why in midlife we're starting to have more shoulder pain as women?
Well, it's kind of like a perfect storm. So if I could take what we're going to talk about and record it, clean it up, and put it on repeat in a waiting room, I would, because I have the conversation, I don't know how many times, day in and day out. So one thing, as we get older, of course, we have to understand that demands change on our bodies. Hormones, of course, everybody wants to kind of sort of blame those types of things. You also have to consider, as we go through different phases of life, we tend to change our exercise patterns. Maybe we don't exercise for a period of time, and then all of a sudden we get excited and we want to exercise again. And that can lead to some issues. Some of us have underlying issues that we don't even understand can lead to shoulder pain. Some metabolic diseases like diabetes and thyroid disease. Some people have some underlying hypermobility and subtle instability that has been present their entire life, but not necessarily diagnosed. Some of us, unfortunately, have cancer diagnoses that we get treated, and we can have, for instance, with breast cancer, the surgeries that we have associated with that to include lymph surgery, and just with the immobilization of that shoulder while you're letting your soft tissues heal, that immobilization can lead to stiffness. There is a such thing as a chemo reaction to soft tissues and joints that can cause stiffness. So there's a lot of different things. And unfortunately, as we get older, it seems like all that stuff starts happening at one time. And let's not
Right.
forget, we're still taking care of our children, maybe now our grandchildren, and now our parents.
Mm-hmm.
So the level of stress that we encounter is higher. Not to say that everything is blamed on stress, but it's definitely one of the factors. When people come in and they start talking about stuff, especially as I start to tease more stuff out of them, most people, a lot of women don't think our pain is something that needs to be brought up, or it may show that we're weak, or maybe we're just not, strong enough. But once you start talking to people and getting more information out of them, all of this starts to add up.
Right, absolutely. And you've already started to mention kind of some of those more common shoulder issues that you see in women. And you brought up a good point that women are just in general, most women seem to be so busy, whether it's, working, taking care of children, grandchildren, taking care of parents. And we sometimes will brush off, shoulder pain, joint pain in general as just a minor inconvenience and kind of go ahead
Mhm.
about the things that you're doing otherwise. Or we misattribute them. We say that, oh, it's just related to getting older or poor
Mhm.
posture. What are some of
Mhm.
those common things you see that we can actually do something about and shouldn't just, dismiss or think we have to live with when it comes to or relates to our shoulder?
Well, most commonly, rotator cuff disease is probably
Mm-hmm.
number one on the list when people and patients come in, and not just women, but we're going to focus on women today. And a lot of times when people hear they may have a rotator cuff problem, they automatically think, oh my God, I
Yeah,
have a
got to
tear
go
and
to
I'm gonna
surgery.
have to
Yeah,
I'm gonna have to have surgery. And
right.
that's so far from the truth.
Yeah.
I can't say it enough. It's so far from the truth. And the one thing that people also have to understand is that even though a rotator cuff tear can happen from one bad moment, more
Mm,
commonly than not, it's from 1,000 normal
right.
moments, right?
Exactly. Right.
So you don't have to have injured yourself to develop rotator cuff disease. And I say disease because it goes anywhere from tendonitis to tendinosis to partial tears to full thickness tears to retracted tears. You know what I mean? So
Mm,
there's some other issues that can occur with rotator cuff pathology to include bursitis, and AC joint arthritis and impingement. So it's really better if you notice it's happening, and we'll go over a few things if we have time about when it's okay not to present from your
mm-hmm.
shoulder pain. But
Mm,
if you're having something, don't let the idea that, oh my God, I'm going to have surgery keep you from going to the doctor to get it evaluated.
yeah.
Um, more for rotator cuff surgery, just real quick, what should happen when you're evaluated for your shoulder problem is that the physician, surgeon, physician assistant, whomever you're seeing, should talk to you about what your symptoms are. They should then examine you. And from that exam, most of us, if we are knowledgeable about this shoulder pathology, will be able to say pretty confidently what is going on. Only then, in my opinion, in my practice, do I even think about getting an MRI. Because if you MRI everybody's shoulder in your building,
You're
you're going
going
to
to
find
find a
something
lot.
wrong. You're going to
Right.
find something wrong. And instead of getting MRI as a shot in the dark, in my opinion, it should be focused, and it really should be used to validate my suspicions as an orthopedic surgeon. So, and for me, pain, and for all providers, pain is so subjective, right? So the physical examination is super important because there's certain tests that we do that if they're positive or if they cause pain or if you have weakness, those, that's more objective for us. And a lot of times pain is not enough for you to decide what's going to have to happen when you go to the doctor. It needs
Right.
to be much more involved.
Exactly. And I love that. And you started to bring up, and we can absolutely kind of get into it now. You mentioned earlier some of those things that, that we don't want to brush off or things that we attribute otherwise. You want to go ahead and maybe get into that now a little bit?
Yeah, so the things that so I'll say this, it's okay to not be seen if your symptoms start to improve on their own, if you are not having overt weakness. And sometimes weakness can also be decreased endurance. So don't just think you can't pick up a really heavy object, but you may not be able to do something you used to do for as long because your shoulder starts to hurt and it feels weak. If you're maintaining your motion, that's super, super important. Maintain your motion. If you're able to maintain your motion, it's okay to move your shoulder even when it hurts, because pain can beget stiffness, but stiffness begets pain. Joints like to move. So if they don't move and they get stiff, you're going to hurt. And that's a bottom line. So we run into a lot of times where patients may come in and they're like, yeah, my shoulder's been hurting me. And if it's their non-dominant side, it's usually even more profound, but I just don't use it. Okay, but then when you don't use it, it gets stiff. And then it gets more painful when you try to use it. So then you don't use it anymore. And then it gets stiffer. So try your best to just continue to try to use the joint. But if you're getting better, your motion is full, you're able to sleep at night, and you can load the shoulder, lightly with minimal flare, then it's probably okay for you to watch and wait. When you can't rest at night from shoulder pain, if your shoulder is starting to get stiff, if it's grossly weak and pain is worsening, that means go get seen. And when you go to be seen, I like to emphasize that not only should you be going to get your diagnosis and treatment plan, but you should also be going to get the knowledge about what's going on in your shoulder, so you can know. Now, some people come and they just want to be told what it is and how to fix it. Unfortunately or fortunately, I educate all my patients. Like, this is what you have. Let me show you a picture or a model or something, so you can know what's going on in your shoulder. You're not crazy. Your shoulder has a problem, but it doesn't necessarily mean we have to do something invasive.
Absolutely. Absolutely. And I think that's important. And you're right that sometimes people just want to know, okay, what's the next step? But we should feel empowered enough
Yeah.
to be able to request that education or a
Mm-hmm.
little bit more information about the diagnosis if we're not getting that. So that really is something that if I'm sending my patients to ortho, we're really sending them to any specialist.
Yeah.
Just make sure you know when you come out of there what's going on, and you
What's
be
going
able
on?
to explain it to someone else to be able to
Mm-hmm.
share with them. And so I think that's important. Now, we started talking about, you brought up hormones, and I know we talked about kind of estrogen when we were going through the knee discussion. And
Mm-hmm.
there is very commonly this thought of, as women age, as people age in general, the thinking about bone strength, bone health
Mm-hmm.
in general, and hormone changes. Are there specific activities or even life stages where you start to see shoulder problems spike? Like if people are doing kind of these really intense exercise routines, or in people who are doing desk work or caring for others, or around perimenopause, menopause, just what are some of the kind of life situations that you say, all right, around this time, around this activity, I start seeing people come in more frequently?
Yeah, I think kind of like what we spoke about earlier. So estrogen, of course, as we start to lose it, it affects everything. Bone health, tendon health, soft tissues, So we definitely have to pay attention to that. But I think what happens is that starts to happen at the same time that we start to care for our parents and start doing more. Maybe we are now caring for our grandchildren and doing more, having a change in our career possibly, and it just comes to a head. So it seems like of course it's happening as we get older. Like, I'm 49, so some of my friends are dealing with some shoulder problems now, and all of us are fairly perimenopausal, et cetera, et cetera. But then when I sit and talk to them, it's usually a several things that I can say, okay, this is probably not helping. You may need to look into this, you may need to look into that. So I don't like to just, of course, blame it all on our hormones.
Right, right.
But it's hard to ignore that part of it because of where we are in our life, in our lives. So with that, I also have to make sure that when patients come see me, like, I call myself a whole person doctor, right? So people come see me, they just want to talk about their musculoskeletal problem, but a lot of times it's important for me to talk about everything else. So
Mm-hmm.
one of the diagnoses that also comes up that's very, 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 very painful, no pun intended, for the patient and for the doctor, is frozen shoulder. So
Yeah.
shoulder or adhesive capsulitis is one of those things that, first of all, the treatment is physical therapy times 1, 2, 3, 4, and 5. And people get so frustrated with it, and we get frustrated with it too, because it literally has to go through its phases in order to improve. Unfortunately, people that have diabetes or hypothyroid disease, hypothyroidism, or things like that, and when you have those hormonal fluxes, are predisposed to frozen shoulder. So I always have to ask about that. Then sometimes we find that, yeah, I'm diabetic. My A1C was 12 the last time. Okay, well, ma'am, we need to get that under control while we try to get this shoulder under control. So we have to make sure to pay attention to all of that. And a lot of times it can take over a year
Mm-hmm.
for
Yeah.
symptoms to resolve after adhesive capsulitis. There's some things you can do in the interim, physical therapy, steroid injections to help with pain, but it really does have to run its course, unfortunately. So the biggest thing I can say about that is for people not to get discouraged. Surgery is usually not anywhere on the list of treatment early on. And I mean early on, like a year. Okay, especially if people are being diligent with their therapy. So that's one that I deal with quite honestly. And sometimes it can occur from a small trauma, and then sometimes people just wake up and their shoulder's stiff. It's just starting to get stiff and they have no idea why.
Right. And then sometimes women try to, push through, right? And it goes back
Mm-hmm.
to what we've been talking about already. I've got a ton going on. Otherwise, I can get through this. This will get better with a little bit of time. And I don't mean push through in that, I've seen the doc. I've got a physical therapy plan. I mean push
Mm-hmm.
through and trying to continue their regular daily activities. What are the biggest mistakes that you see women make when they try to push through? And again, kind of going back to your talk earlier of, when do you say as an orthopedic surgeon, you need to be in my office?
Yeah. So if you have pain and you've not sustained any trauma, that's important. Right? Like if you hurt yourself, you can say, okay, I know I did this the other day. I expect to be uncomfortable right now. It may take a couple, 2 or 3 days for me to feel better. But if you're having pain and you know you haven't done anything to yourself specifically, then you need to make a mental note of that. Um, so in the same vein, if the onset is gradual, and like you said, if you literally feel like you're powering through, like, okay, I just got to do this despite the fact that my shoulder is killing me, that's a red flag. And a lot of times we as women feel like we're going to be misread. And it's just, a lot of that is it's just, we have to get out of our own way and demand, like you said earlier, the education and the respect from your provider. Look, I know something is going on with me. I'm not being dramatic. I know my x-rays look normal, but something is not right. And that
Right.
should not dissuade somebody from going to, to be seen. Don't get into the idea that this is just life. My shoulder's just going to hurt. No, that's not true. That's another way that people or women kind of just power through. I got to do it. It's going to hurt anyway. I'm getting older. My grandma's shoulder hurt. My mom's shoulder hurt. Everybody had
Mm-hmm.
a hurt shoulder. They didn't do anything about it. So I don't need to do anything about it. We don't have to live that way. So when those things are happening, and you may go to the doctor, orthopedic surgeon, and just because you see an orthopedic surgeon doesn't mean you have to have surgery.
Right.
But you may go and they may say, no, ma'am, structurally you're fine, da 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 da. And that should at least give you some reassurance. You know what I mean? Like it's okay to go and find out, okay, this is what's going on, this is what's going on, this is what I can manage, this is what X, Y, and Z, versus just kind of dealing with it and not
Mm-hmm.
knowing. The
Right.
education part of it is huge, because if you know what you're dealing with, it's easier to manage it, in my opinion.
Right. Oh, absolutely. I agree. And I think that just like you said, the education part is so important. And as we wrap up, I know you do a lot of educating with your patients in your practice, but you're also kind of active on social media. Tell our
Mm-hmm.
listeners where they can find you on social media, and then just any other information about your practice or your social media that you want to share. And I'll be sure to include everything that you mentioned in the show notes so that you can easily, after listening to the episode, go down and click on it and be able to link up with Dr. Johnson.
Okay, that sounds good, because yeah, I can talk about shoulders like all night and all day. So my website is www.drshawnmdortho.com. I am on Facebook and I'm on IG. One thing I tell patients or tell people, like if it's something you want to hear about or you're concerned about, you just have a question, jump on my IG, which is austin.county.orthopedics, ORTHOPEDICS, I'm sorry. And just drop me a question. And sometimes I'll do these series called Straight Ortho No Chaser. We
Yeah,
just
they're so good. And they're so always like right on time. Like, oh.
yeah. So if you and it's so much easier for me to answer somebody's question versus
Mhm.
me just get on there and talk. So if you
Mhm.
have a question about something, pop on, ask the question, and I'll be sure to answer. The other thing for your Texas listeners is that a lot of times patients will make appointments with me for quote unquote second opinions when it really does boil down to just someone to sit and talk with about
Right.
their problem. Not that they want to leave their surgeon or leave their, none of that. It's just to have another set of ears and another way of things being explained. So I do offer, I call it like a telemed triage. So you
Hmm.
can you can make an appointment with me. We talk talk via telemed. And most of the time, the person surgeon is not off base at all. It's just that they didn't get the education that they needed. And then after we chat, they go, oh, okay, that makes sense. And they go back to their surgeon. And I don't mind that because it makes everybody's, in my opinion, makes everybody's situation better. You know, I give them questions to ask their surgeon that they hadn't thought about, or I break it down so that they can understand, you know, a little bit better, and hopefully they can approach their situations more eyes wide open. So for Texas listeners, can definitely help them with that.
Absolutely. I think that's incredible. Well, Dr. Johnson, I appreciate you so much for taking the time to record this episode with me today. It is always fantastic to have you on the show. And like I said, the second time here, first to cover knees and this time shoulders, and we'll find another joint to talk about in the future. But I like to give guests the opportunity to kind of give us closing thoughts, and whether that's related to shoulder pain, any other joint pain, or just any advice in general that you would have for my listeners. I'd love for you to share
Um,
it with us.
yeah, I mean, for me, I harp on this and I harp on this, and that's education. And when you leave the doctor's office, to feel like you've gotten your questions answered.
Hmm.
And if you, and I feel super strongly about this, if you are seeing a provider and you don't feel like you're able to get your questions answered, whether that be in the office with them, some physicians have very good portal situations and other ways to communicate. But as long as you feel like you're getting the answers that you need, then that's great. But when you're not getting those answers, you've got to make a change,
Hmm.
because we see hundreds of people every day, every day, every day. But it's only one of you. So if you're not satisfied, and really no, I mean, if you're not satisfied, you should find a provider that you feel comfortable with talking to, that you know is going to answer your questions and take all of your concerns seriously, et cetera, et cetera. And I can't
Right.
say that enough. I tell that to my own patients. If we're not quite on the same page, I'll be like, maybe we should have you see somebody else. And there's nothing wrong with that, because I want
Hmm.
everybody, to get what they deserve out of the visits and the relationships with their doctors.
Absolutely. I think that's so important. Well, Dr. Johnson, thank you again so much for joining us today. I wish you the best in all you do. And again, thank you. We appreciate you having you here. Hey, thanks for listening in today. I hope something you heard in this episode will help you on your journey to becoming healthier. Remember, this podcast offers general health information. I am not your personal physician. If you need advice that is specific to you, be sure to consult your physician. If you enjoy this podcast, please consider sharing it with a friend and reviewing it on Apple Podcasts. Also, be sure to subscribe to the show so you never miss an episode. Tune in next week for another great episode of Headed to Healthier. Until then, take care of yourself. Talk soon. Bye.